Nursing Theorist Presentation for Nurse 311 by Emma M., Sarah C., and Rachel S. Nursing theorist Betty Newman and her professional career. She was a hospital nurse in California to then become the head nurse at Los Angeles County General Hospital. She then obtained a master's degree in mental health and public health consultation from UCLA and then a doctorate in clinical psychology. She then became a department chair in the UCLA School of Nursing graduate program and developed the first community mental health program for graduate students in LA. She was one of two first nurses to develop the nurse counselor role within community crisis centers in Los Angeles. She then started a private practice as a marriage and family therapist, specializing in Christian counseling. Betty Newman created the Newman Systems model. This model was to understand that every person or client is in interaction with the environment. This model focused on seeing a patient holistically rather than just someone who has a medical need. Focuses of the model include physiological, psychological, sociocultural, developmental, and spiritual. Newman based this model on the belief that the nursing profession is a unique profession in that it is concerned with all of the variables affecting clients in their environment. This model focuses on the primary goal of nursing as stability of client and client system, focusing on clients' interaction with stressors and the response to stressors in relation to wellness and health. With stressors, Newman focuses on prevention as intervention to reduce clients' encounters with environmental stressors and improve overall health. The Newman model and its effects on nursing. The model allowed for creation of a Newman nursing process format to be created. This format focuses on 3 key items to allow for collaboration between the nurse and the patient. These include nursing diagnosis, nursing goals, and nursing outcomes and evaluation. This model is a framework that has been implemented throughout the U.S. in several different nursing practice facilities. A key role to nursing is understanding a patient as a whole and being able to identify different aspects that may be contributing to their health, which is the basis of the Newman Systems model.
Mrs. Joanna Johnson is a 67-year-old female presenting with left-sided rib pain after a fall. The patient reports that the fall occurred 2 nights ago when she attempted to walk to the bathroom in the middle of the night. The patient's husband notes that Joanna has been waking up more frequently with an urge to urinate and has noticed an increased incidence in falls in the last 6 months. The patient has a history of multiple sclerosis, constipation, hypertension, and depression. Additional data. Mrs. Johnson reports that she has ate very little since the onset of her pain due to its severity. She adds that she has had a lack of appetite for months. She has been experiencing a sudden urge to urinate for the past 5 days. She has not made it to the bathroom on time on multiple occasions due to her mobility issues. She has been drinking less water to avoid episodes of incontinence. She is concerned that her MS is progressing and reports that she rarely leaves the house anymore due to fatigue and embarrassment of her declining condition. Mrs. Johnson's assessment findings are as follows. Her blood pressure was low, heart rate was high, and temperature was high. Her pain began 2 days ago and is located at the left rib cage, along with some bruising. She describes the pain as constant, sharp, aching, and stabbing. It worsens with walking, bending, and eating, and it improves with ice and lying down. She tried Tylenol and 4% lidocaine cream for the pain, which provided some pain relief. Her lab results came back with positive for E. coli bacterium, and she was hyponatremic and had metabolic acidosis. Based on the initial assessment of Mrs. Johnson, the following nursing diagnoses were developed. Acute pain related to tissue damage and inflammation, fluid volume deficit related to hyponatremia and insufficient fluid intake, functional and stress urinary incontinence related to skeletal muscle atrophy and limited mobility. Now, considering the Newman system model, we would also include nursing diagnoses that focus on the patient's environmental stressors and psychological status. Some diagnoses that we could include are ineffective coping related to depression and withdrawal from social activities, disturbed body image related to chronic illness and impaired mobility, risk for falls related to atrophy of skeletal muscles and fluid volume deficit, and risk for confusion related to acute urinary tract infection and electrolyte imbalance.
All right, so I am worried about Miss Johnson because I feel like a lot of her problems are coming from her depression, which is, a lot is from probably the MS. And so, I would recommend some NSAIDs for temporary pain relief and some antibiotics to treat that E. coli in her for her urinary tract infection, but I would also like to see her in some therapy to get some effective ways for coping and ways to handle her depression. I would also want to see her join some like a senior community center or like a group of some sort, like a MS group, where they have like they're there for each other. And even like some senior fitness centers, like the YMCA has a lot of programs there. They also have like a community center going on where they get together and they sell things, and they're just there for each other. It looks very like family oriented, and like they care about each other. I've not been a part of one, but I've been to their little shops and stuff, and they just seem like they're very caring for each other. So I would definitely want to see her involved in something to get her out of that isolation that she's got herself into, and help her become more social. I would also try to get her to talk to a nutritionist because um, even though I do think the depression is messing with her eating habits, if we could get a nutritionist in to help her find some things she likes to eat, try to show her different ways of how to get in those electrolytes and those nutrients so she's not deficient in those things. And that will help with the falls and, the UTI, if she can help get in that water intake and a lot of fluid intake. And yeah, so I that's what I would like to see for Miss Johnson. So some outcomes I would want to see with Miss Johnson is I definitely would want her to be seen, like have an appointment, I guess, with a therapist. I know it is so hard these days to get into therapy, but I would definitely want to see her at least have an appointment set up. Another thing I would want, I didn't mention this vocally on the last slide, but I definitely want to see if she's into taking some depression medications just to help get that edge off for a little bit so she has, maybe the courage to get involved with a community center group or fitness program. Um, but yeah, those are the two main things I would want for her mentally. Physically wise, I would definitely want to see her pain scale um go down and be appropriate for her MS. Make sure that that goes down a little bit. I would also want her UTI pain should be a 0 within a week with those antibiotics. And if it is not, I'd want her to come back and see me so we could get another urine sample and see what's going on, because definitely want to get that cleared up. The rib pain, since that's musculoskeletal, it can kind of take a while for that to go away. That takes about 2 months. So she that would be something she just have to kind of work with and take pain meds as needed and try to rest and ice and just be easy on those ribs. Um, because she complained of constipation, I'd want her to take some Miralax, and I'd want that to be effective for her within 48 hours. If the Miralax isn't helping with 48 hours, I'd really want her to give me a call, so we could see if we need to go about doing something else, if we need to check another CT scan and see if there's any kind of obstruction or anything like that. So I definitely want to hear that she had a bowel movement soon. Um, the last thing I feel like is a visit from a nutritionist, or at least a phone call should happen, especially if I put in that referral. I would want to see that occur for her. I definitely want her to follow up with me in about a month, um, physically, make an appointment and physically come and make sure that she's okay and she's doing better, you know, with her MS, with her mental health. I am a little concerned for her as a person. And I think that's what Betty Newman was trying to get across was, okay, yes, maybe this person has MS and a UTI, but that's not everything. There's so much more to this. You can tell a lot is from the mental, exhaustion of having MS and not being happy with your body and just being very sad, isolating yourself, because you feel like maybe a bothersome to people. Maybe she feels like she has to ask her husband for more help and her family, and she feels nervous about going to these community centers and group centers or whatever, because she does fall a lot, or she looks very small and she looks weird and she has these twitches. And I would just really want her to get involved with a community that understands MS and understands the geriatric population. And I really would be looking to make sure that she gets somewhere where she is not having isolation. And yeah, that's mainly what I would want for her and what I'd want to see. And I would communicate all of this with her. I'd communicate what I feel and how I'm worried about her mental health. And I'd just be really open with her, because I think that's one of the best things you can do, and is be open with your patient and tell them what you see and what you feel, and let's work together to fix this and get you back on a healthy track, and make everything come a little bit more normalized for you. I feel like this theory is one that means a lot to me, because you don't just treat a symptom. You don't just treat a lab value. Okay, someone has elevated white blood cells. Okay, they have an infection. Let's just treat it. Like, no. Why is this happening? What is it that they're doing that has caused this to happen? Or is it something they're doing? Is it where they live? Is it what they do for work? Knowing this person as a whole can really show you why they are getting an infection, or why they are falling, or what is happening to them to cause them to have this issue, for them even having to come to the hospital to begin with. And I feel like some providers and nurses really do care and they practice this, but others, need a little bit of work. And I feel like with this new generation of nurses, with us at Bethel really ensuring this holistic view of care, I do believe that we will be the change that needs to happen for the future of people, especially people in our community. I want to be able to, as a nurse, ask all these questions about you and learn who you are and learn what you've done in your past or what you do right now for work. Do you have kids? You don't have kids? Why? What's going on, with your life? and understand you and make my diagnosis from there, and not just treat a lab or treat the monitor or anything like that. I want to know you as a whole and, hear what you're saying. So that is something that I really want to see moving forward. I think knowing that and doing that with proper education to our community, with understanding issues and how germs spread and bacteria spreads and virus spreads, and just educating, you know, the patients that we see, I think we can make a difference in the hospital world and seeing people and yeah.